let me introduce some of my guests for you in the course of the day and let you know who is joining us via Zoom at this moment. So in the course of this program, we'll be having Dr. Kofi Abochi, Dean, UPSA Law School. We have Rhoda Osei Afo, Project Manager, Coalition of Domestic Election Observers, CODEO Secretariat. Peter McMahon, who is the Campaign Manager, New Patriotic Party, NPP. That's for the 2020 campaign. We have Professor Kwesi Enin, Director, Faculty of Academic Affairs and Research, Kofi Annan International Peacekeeping Training Center. We have Kwame Sapong Esiedu, who is Pharmacist and Fellow, Ghana Center for Democratic Development, CDD. And Kwame gave us a lot of learning and education within the COVID era. Immediately it broke up to the point, setting point, and he has been doing that up to date. We have Dr. Augustina Angelina Silverkin, who is Senior Lecturer, Department of Theoretical and Applied Biology, KNUST, and Research Fellow at the KCCR, KNUST. Of course, we will also have Professor Godfrey A. Bokpin, and that tells you of the issues of the economy. Suleimana Brahima is Executive Director, Media Foundation for West Africa. Other people will join us from the anti-corruption fraternity, the media fraternity as well. We have Manasseh Azore Awene, and we'll be joined by some other persons as well. So let me, at this moment, welcome via Zoom Mrs. Rhoda Osei Afo of the CODEO Secretariat. Rhoda, thank you very much for making the time to join us once again.
Thank you and good morning.
Great. I'm excited hosting you anytime. Also on Zoom is Professor Kwesi Enin, Director, Faculty of Academic Affairs and Research, Kofi Annan International Peacekeeping Training Center. Thank you, Prof, for making the time to join us.
Well, thank you very much. It's always a great pleasure.
Great. I think you will have to unmute, or if there's some adjustment to be made to... Right. Okay. I'm told you are on, but I didn't hear you when you spoke. Hello, Professor.
Well, thank you very much. I think it's always a great pleasure to join you and to join your great panel.
Okay. Right. Also on Zoom, Dr. Kwame Sapong Esiedu, Pharmacist and Fellow, Ghana Center for Democratic Development, CDD Ghana. Kwame, thank you so very much.
Thank you and good morning, Samson, and good morning to the panel and good morning to all listeners.
Great, great. So, look, let me immediately start with you, Kwame. For where you are getting a second wave. Just quickly about that, a second wave of COVID-19, and so there's practically no Christmas for you as in any public activity. How is the situation?
Samson, thank you. It's interesting, but what I'd say is it's the last straw of the dice, so to speak, when it comes to COVID in the UK, because as you're aware, there's already a vaccine in circulation, and as at yesterday, almost 790,000 people have had their first dose of the vaccine. There's an expectation that on Tuesday, which is the 29th, the Oxford vaccine would be giving the all clear as well. And already there are about between 80 million and 90 million doses of that vaccine installed. So there's going to be an accelerated, vaccination drive. In fact, all the protocols have been issued. All the indemnity insurances for health professionals like myself who would probably be vaccinating have all been issued. Everyone has his copy. The cold chain processes are in place. They are going to use the army. They are going to use stadia as mass vaccination sites. So basically what I think the government is trying to do is to shut everyone down and slow contagion until they can accelerate the vaccination. And when they've got to about 40-50% of the vulnerable population, they'll start gradually opening up, because then the virus would have very little space to move. So in a way, we are constrained in our home, but there's a sense that the end is nigh. And a lot of people, especially the elderly, are thinking, if we've managed to survive it for almost a year, why should I gamble with 2 months and lose my life or get hospitalized? So it's a bittersweet, if you like, situation we find ourselves in.
We here can only hope and pray that the vaccine will get to us too. The president has been speaking. I'm sure you have heard him. He's optimistic that we will be lucky. Is there a basis for the optimism that those who have done the vaccine themselves are now in the process? And even if there's that basis for the optimism, how soon can we expect that we will also enjoy it?
I'm a realist. So in all this, I have been following the discussions going on between Gavi, which is the Vaccine Alliance, the World Health Organization, and what's called COVAX, which is a conglomerate of countries who actually haven't been well endowed scientifically to engage in the vaccine research and other things, and haven't also got the resources. Because if you look at it, currently of the 1.3 billion, and that is huge, 1.3 billion doses of the vaccine candidates that are likely to see the light of day by the end of December, 15 countries have held them in ransom and in store. I mean, if production starts today, unless they have gotten their doses, UK, for example, has about 300 million doses already banked up from Pfizer, from Moderna, and from, AstraZeneca, Oxford. So COVAX went into this agreement together with an Indian company which produces vaccines en masse, to ensure that less endowed countries and lower middle income and developing countries can get access to the vaccine. But there's a caveat. The caveat is that you can only get as much as for 20% of your population and for your vulnerable people. The other caveat to it is that it doesn't kick in until the end of the first quarter of 2021. So when I heard the president speak, and I heard others say that we'll start getting vaccines by March, I cringed a bit, because I've been following the COVAX conversations. And I even was on the last webinar held by the WHO Director General on the 18th of December, when he announced further COVAX agreements. So I know that we would get vaccines, but I am a realist and think that we probably wouldn't get anything trickling in until about the second quarter of 2021.
I see.
The next question is the COVAX agreement itself, which says health professionals and at-risk vulnerable populations. In the UK, there is an up-to-date register of the step-by-step vaccination protocol, starting with people over 80 years, then coming to people 70 years and in nursing and residential homes, then 65 years vulnerable population. But before that, for health professionals who will be involved to be vaccinated, because the last thing you want is for infected health professionals to go around vaccinating people and killing them all off before the immunity has kicked in. I wonder if at this point we even have identified our vulnerable population in Ghana. So that is one of the things that I look at. So yes, we would get vaccines, but it would be intriguing to see how the vaccine dynamics would play.
All right.
And then even with the vaccine dynamics, which of the vaccines we're going to go for, because of the cold chain protocol, some have to be stored on dry ice and in liquefied nitrogen because of the minus 70 degrees. Others, like the AstraZeneca one, has to be stored within 2 to 8 degrees. So all these dynamics will come to play.
All right.
So let's be realistic.
All right. Thank you very much, Kwame. We will I'll return shortly to test your sense of the politics in the country, because we are getting you to discuss politics. Right. I'm really keen knowing how he's going to deal with the questions of politics. You should not always leave the politics to the so-called politicians, partisan politicians. So, Merry Christmas then. That is what I wanted to say first, but I paused because I felt there's really no Christmas in the UK.
No, there is Christmas, Samson. There is Christmas. I mean, it's a good thing because I've been home with the family and all that, and with a year that has been so much of a roller coaster for health professionals. I mean, having this break is good as well. I've not moved the car since Thursday. I've not even gone out of the door, and that is blessing. Trust me.
That is blessing. All right.
Yes.
Good. Now let's get to Rhoda. Rhoda, do you still live in fear of COVID? Checking how people behave around the country, it doesn't look like, in fact, some believe that it's gone. After the super spreader events, the politicians who made the rules and tend to completely ignore and broke the rules, gathering thousands without masks and no spacing, nothing. We recently are now being told about giving COVID-19 updates. We seem to also have paused or seem to have aborted the process. Do you still live in fear of COVID-19, and how are you celebrating the Christmas in COVID?
Good morning once again, Samson, and thank you for the opportunity. Yes, I think to a large extent, you get the impression that life is back to normal for many people. If you move around town, if you look at the various open spaces, whether it's drinking bars, whether it's restaurants, you get the impression that people have really put this virus behind, even though we know that it's very much around. And for me, I think personally, for all of us, we owe ourselves that responsibility of reminding ourselves constantly that this is still real, because other than that, if you step out in the open space, you get the impression that this is behind us. Shops that used to enforce strictly some of the mechanisms or measures like washing of hands before entry, I see some of these shops now just letting things pass. Now you're not required to wash, you're not required to sanitize in some of these shops. And so there's that individual responsibility that we all have to exercise. Other than that, I think it's going to get dangerous once again. But we are managing with Christmas. We are home trying to make the best out of the moment.
Right. Thank you, Rhoda. We'll come to deal with the politics of presidential election, whether there will be a petition, and also the Techiman South and Hohoi Dabako. Professor Kwesi Enin, the president gave us an address and actually said that the drinking, bars, restaurants, stuff, things were still in place, that the beaches were no-go areas. We are seeing pictures of the beaches being packed. People don't seem to have listened to the president, and even if the rules have been made, nobody is interested in enforcing them.
Well, Samson, I think there is a certain irony here. How do the public, or how does the public, or should the public respond to a well-couched national message in response to a pandemic when we've just gone through an election in which all the protocols were overlooked? Part of the messaging, whether it's political messaging or communication, health messaging, communication, security messaging, or communication, must be couched in a manner in which those who present the message themselves are seen to be following the content and the protocols around the messaging. So we've seen several phases and cycles in how the Ghanaian public has responded to the COVID messaging. In the initial phase, there was a bit of reticence, confusion, but as the lockdown, took off and the numbers increased, we saw, actually public acquiescence support for the usage of face masks, social distancing. We saw the rush in hamstring, food and provisions. And then over time, as we went through the voter registration, the protocols got more and more relaxed. And over time, prior to the campaigning, there was this perception that, well, look, life is almost back to normal, although it is there. And I think Joy FM's campaign, in which somebody says COVID is real, protect yourself, has been very useful. But I think it's going to be extremely difficult to convince the public once more that we need to follow the protocols. Now, when you wear a face mask in Accra, you are actually the odd one out.
That's right.
And people do look at you as if, but who is this character? Everything is safe. We are all.
You're right.
Well, so why this face mask? So we need a new type of messaging that convinces people, or probably, as Kwame was saying, not to create the impression that there is a vaccine and therefore, we can reduce or we can lower our guard. But It's going to be a very difficult uphill battle to convince people.
Right.
And the messaging once more must be couched in a manner that people can locate themselves within it, can understand it, and can see the essence of following the protocols. And I like Kwame's point about that in the UK, the thinking is that if I've survived for more than a year and the vaccine is just around the corner, then I'll do what I need to do, to make sure that I survive and I can also get the vaccine. So there's a need for the Ministry of Health and other stakeholders to begin to couch a message that gets people to understand the dangers of this.
All right, thank you very much, Dr. Kwesi Enin. Let's get to Dr. Augustina Angelina Silverkin, who is a senior lecturer, Department of Theoretical and Applied Biology, KNUST, and research fellow at the KCCR, KNUST. Thank you very much, Dr. Silverkin. She has also helped us quite a lot, helped the nation a lot when COVID broke, and we needed the experts to help the nation to steer away from it. Thank you for joining us.
Thank you, Samson, and good morning to you and to your cherished listeners. Merry Christmas, and to those in your studio and those who have also joined us via Zoom, your panelists.
Great. And I must announce that we have also just been joined by Dr. Kofi Abochi, Dean of the UPSA Law Faculty. Thank you very much for joining us, Dr. Abochi. Right. So now, what do you say? Begin by addressing where we find ourselves. It does appear everybody feels it's okay now. And like Professor Enin said, I have been to a number of programs with my wife, and we discovered that we're the only ones in mask. And we felt a bit odd, but we had to insist.
Samson, it is a worrying situation. I assume people feel that the virus is no more, and I share the same views you just shared. You step outside there, and you may really be the only one in nose mask. It's quite even surprising when you go into shopping malls. They may have actually displayed signages indicating adhering to physical distancing, wearing of nose mask. But you want to check out, you go to the checkout tellers, and you realize that they themselves are not in nose mask. So it's a big issue. I don't know whether at a point in time we all went to sleep, we relaxed, we assumed that maybe the virus has vamoosed some way, somehow. But I think that, like Prof. Kwesi Enin indicated, we need to go back to the drawing table as soon as possible, especially with the emergence of these new variants all over, I don't know if we even have it already in the country. Maybe because we haven't looked out for it, we may assume that it is not here. So we need to go back as soon as possible. And my students will say, you don't have to slack. We really need to go back. I mean, we've done a lot. We've done well in some areas. We haven't done so very well in some areas. It has been very good. It has been challenging for some of us. It has been very exciting. For us in Kumasi, KNUST and KCCI, we had the president visit our facility. It has been very amusing as well. I mean, you see the way people wear their nose mask and you're like, really, what is going on here? It has been fascinating. I mean, at a point in time, I think almost all Ghanaians became virologists or we became molecular biologists. So you heard words like PCR, you heard words like antigen, you heard words like RDTs. And I think even for your station, you actually introduced a new program. Is it Say It Right? Where initially we were of the opinion that as for quarantine, it is quarantine. But you taught us that it should be quarantine. So a lot of things have gone on in the past. And I think this is maybe just about the time we want to pick up from where we left off and forge ahead. I feel the journey ahead may be more tedious. And so we need to psych ourselves up. Every single person, every single section within the country, every single organization should pick up from where they left off. And then hopefully we will be able to, should I say, meet this virus boot for good.
So come to how we have, as a nation, managed COVID-19. From where you sit, if you were marking your students, satisfactory, average, excellent, and what goes into the mark you will give?
This is I think I've given bits and pieces of everything.
Right.
I would not want to put a mark to it, but I think we have done fairly well from March, when I think the 12th of March, when we had our very first case, when we entered into a partial lockdown. We had some hitches here and there. And then we eased the restrictions. Then we saw a huge jump in terms of the number of cases. Churches had to ease out gradually. So I think we've done a lot. Of course, at a point in time, I think sometime in September, we had to open air borders. And I had a friend come in from Australia. He was amazed and full of praise for Ghana. The fact that we had actually instituted clear guidelines and systems in place to enable people who had traveled into the country to get tested. I remember at a point in time, I think sometime March thereabout, I mean, we were all over pushing for test. I think we even said aggressive testing.
Right.
And the president, in one of his addresses to the nation on COVID, indicated the 3 T's, trace, test, and treat. Then at a point in time, we relaxed in terms of our contact tracing. So it's difficult for me to really put a percentage. I think we've done so very well in some areas. We could have done very well in other areas. We all need to applaud ourselves. But whilst applauding ourselves, we also need to realize that really there may be difficult times ahead. I don't know if we even have, in terms of some of the facilities we have, to really enable us look into the dynamics of this virus I call a smart virus, which I also tag it as a highly promiscuous virus. Because look, this is so smart, this virus is so smart such that it won't even wait for you. The very moment you try to, put your house in order, it would have gone ahead of you. So you always have to outsmart the virus. And when you look at the virus itself, it doesn't have the time to go back and read whatever it has produced. So they call proofreading. It will never do that. It's happy to make mistakes. So that's how come we see all these new variants showing up in Nigeria, in Netherlands, in Germany, in Denmark, in France, in UK. I don't know, in South Africa, of course. So it's difficult. So Samson, forgive me if I'm unable to put a percentage. This is different from marking my students
right.
in
That's
the
okay.
classroom or
That's
in the
okay.
lecture room.
So presently, as we speak, we are told of a new variant, and lockdowns are being reintroduced, and even travel bans are being reintroduced in some places. Some countries are not receiving visitors from the UK. Should Ghana be doing the same? What's going on with this new variant? We thank God that we were sort of, some say Africa was largely spared by God. But this new variant, what should be the fear?
We need to be cautious, I think. And I think we need to, as soon as possible, get into sequencing. You know, unlike the first so-called wave, when we were saying, or when we indicated that we should be testing, I think now we should also be preaching sequencing. Because if you do not sequence, you will not find the mutations. And of course, even when it comes to the testing strategy or the testing protocol you are using, it depends on the target you are really looking out for. So if you don't look out for that target and you don't do sequencing, then it becomes impossible for you to identify if you have such a new variant in your country. So we may want to look at improving our sequencing strategies. I know in Ghana, WACBIC may have maybe the only institution with the capacity to sequence. So whilst looking into putting up more treatment centers, I mean, in the area of the laboratory, I think we've done quite well, and I need to commend Professor William Ampofo. He coordinates the laboratory testing in Ghana. But how about setting up maybe a BSL level 4 lab in Ghana? Because if we want to do some animal model studies, if we want to do some high throughput, state-of-the-art things, I mean, of course, KCCR and Noguchi, we already have a BSL level 3 lab or labs in Ghana. We've done a lot of new things. So it will be important for us to, at every stage, those who are into project management, they do something known as monitoring and evaluation. And I think some way, somehow, we have done monitoring and evaluation in the past. But going forward, now we see what is already going on in some countries. I don't think we need to sit down and wait. We need to enforce aggressively mitigation measures, the non-pharmaceutical measures. I call them very difficult measures to implement, yet very simple, because you only need to be washing your hands. But because we may not be used to washing of our hands, then it may be difficult for us to inculcate it into our daily lives. Physical distancing, I mean, initially, the WHO even called it social distancing. Now we've changed some of the phrases. Now it is social distancing or physical distancing. It's so difficult for us as Africans because we are social beings. I mean, look, it's Christmas. You want to hug people, you want to visit people, you want to have parties and do all sorts of things. But this is the best of times to ensure that we are adhering to some of these safety measures.
So at this moment, what do you say for the people, including citizens abroad, who are asking, and some of them have reached out to me personally, asking if they were vaccinated, should they still come to Ghana, being required to show a test and to come and do a test here in Ghana again?
Again, Samson, I think we need to erase the perception that once you are vaccinated, that's it. You can even go walk around without being tested. Look, I read somewhere that you may be vaccinated, but who knows, a virus can actually sit on your nostril, and chances that the virus can jump onto someone else is so very high. So, of course, I think it will be up to us as a country to decide whether we want to also prevent people, especially from coming from areas or countries where we have already seen this new variant or new variants coming into our country. We have to decide on that. And the good thing for us is that we have already established a very nice testing strategy. But honestly, I don't know the target, because this particular variant is hosted on the S gene. I don't know whether we are looking into the open reading frame or we are looking into the N gene. So we have to do, that's how come I mentioned monitoring and evaluation. We need to go back to the drawing table and look at the testing regime we have, as well as the diagnostic methodology we are currently using. If it is such that we have to change our style, we have to do it. And I have always said that, look, I haven't seen a pandemic before. We may commit some blunders, but then we don't have to keep on committing blunders. We have to, at a point in time, change our style, change the things we do, and then pick it up from where we left off. So you may be vaccinated, but it's important that when you get into our country, you also need to undertake the test. Of course, like I said, if our test methodology or the diagnostic method, I know it's an antigen test based on immunofluorescence or fluorescence, something like that. But I don't know whether it's really targeting the S gene, or it's targeting the open reading frame, or it is targeting the N gene. So we have to look into what we are doing and then put in the necessary measures.
Will be, as we speak to leadership, to give direction. Everything, like they say, rises and falls on leadership. But we, the people, we have a very important role to play. So, like the president said at the beginning, as you step out of your room, be aware that COVID is lurking. Now, what should be our attitudes generally? And reopening of schools. We have had a whole year of no physical school attendance, except for the emergency situations that we did for those who needed to sit their exams and so on. We know some universities are introducing what they say is 30% virtual, 30% is it physical attendance, and then 70% virtual beginning next year. We understand also that the president is seeking, to consolidate advice and then speak to the nation as to how we go. Tell us, what do you suggest?
You always give me the difficult questions. So again, I think we need to look at, whilst learning from other countries, we also want to couch something to suit our environment. I know in the UK, for example, even though some areas were under a lockdown, some creches and nursery schools were allowed to go to school. Maybe so their parents could have some time. But it was important that as soon as someone tested positive in the class, the entire class had to go into a serious quarantine. Do we want to introduce that? Maybe as a country, we may decide to do some more strategized shift system, reduce the time children spend in school. And I hope that if, as a parent, you had your kids sit at home from March till December, you did not slack in teaching them how to wear the nose mask, how to wash their hands, how to observe or maintain physical distancing. You are not waiting for schools to reopen before the teachers teach your words. So I hope that even whilst at home, where we were given, as parents, we may have been given some time off. And I hope that during that time, we managed to educate and teach our kids. especially for the very, very young ones. We know that with this very new variant in South Africa, we know that very young people end up being affected. We don't know whether it really presents with a very severe form of the old SARS coronavirus too. So I'm very positive that government is already looking into some of these issues, maybe through the Ministry of Health and as well the Ghana Health Service. I know there's a very strong team, I think known as the NTCC. They meet almost every 2 weeks and they are very, very serious. So I'm very positive that government is already looking into whether to really go back to school, I don't know, or whether to still do some sort of easing in terms of the schools easing in some phases.
Right. Dr. Angelina Servakin, we thank you so very much. And we want to thank you and all your colleagues, particularly from the Kumasi Center for Collaborative Research into Tropical Medicine, for the time you have spent with us the whole of the year since COVID decided that we shouldn't have comfortable lives in 2020.
Thank you. I appreciate it, Samson, and Merry Christmas. I hope 2021 will be better. We will adhere to the protocols going into the new year. Thank you very much, Samson.
Thank you very much indeed, Dr. Servakin. And now, Kwame, let's conclude on this subject of our management of COVID-19, and then we can go into the politics of so-called fictionalized and flawed elections. I am quoting President Mahama, and then also resolving, quote unquote, Techiman South and Hohoi. That's if there's anything to be resolved. Kwame, what do you say about the management? And you guys played such a pivotal role in assessing the government and all the stakeholders from time to time. Sometimes they were very uncomfortable and they reach out to us, they reach out to you too, and let you know some of the things they wanted to do and some of the views that you gave that they took on board and they were working with. Kwame, unmute.
Thanks, Samson. I said, I totally agree with Dr. Angela Servakin that we've done fairly well. We could have done a lot better in certain aspects. And yes, critique brings discomfort. From where I sit, the word is called challenging conversations. And our education hasn't taught us to give and receive feedback. It is one of the things that we struggle with as a people. And often, if you are in the business of giving feedback, you get the wrong end of the stick. But when you've worked in senior leadership for a long time, you also come to accept the discomfort that comes with giving feedback. I always quote from a book written by Benny Brunet, which is Learning to Lead, that to lead is to take pain.
Yep.
So for me, I never for 1 minute take anybody seriously when they either try personal attack or personalize what I say or personalize what any of my colleagues are trying to do, looking from the other side. And this is where I'd go. For example, if you look at this whole variant thing that we are now dealing with when it comes to COVID, the reason why UK was the first to identify it is, if Dr. Servakin will bear you out, 40 to 50% of all codes, genealogy reported worldwide, are from the UK. It's fascinating. Globally, to the global database, 40 to 50% of all the codes emanate from the UK. And so with this particular virus, because as they test the sequence, they were able to pick up immediately that it was a pocket in the London area, Kent area, and parts of the southeast. You're right in saying the world then started saying, we're not going to accept travelers from the UK. But immediately the European Union did it. They discovered to their discomfort that the variants were in their country anyway. It was just that they were not sequencing. So for us as a country, like Dr. Servakin said, we don't even know if the variant is in the country because there are variants in Nigeria, there are variants in South Africa. Unless we are sequencing, we wouldn't know. So that part of our management probably needs improvement. Then also, an area we struggled with that we probably need to improve is the risk communication. Because risk communication is about behavioral change. And if all the panelists agree that no one is wearing face masks, no one is washing their hands, you go to supermarkets and everything is all at sea, then we need to improve that communication, because without that communication landing properly, we are not going to get the behavioral change. And we're going to live in this foxpass of thinking that, you know what, there's a vaccine coming when we don't even know when the first vial is even going to land on our shores. And when that happens, the other thing about the vaccine that we all have to bear in mind is that we all know the data currently says that it prevents you from, if you get the virus, from getting seriously ill. Often you don't feel it at all, like all other vaccines. But the data on its prevention of transmission, that is, in case you are vaccinated, you don't get ill, but you can transfer it to another person, is still being studied. So even the people who are vaccinated could probably transmit the virus. We don't know. And therefore, even when we get the vaccines into the country, we cannot go back to business as usual. I mean, that is one thing that's being said in the UK openly, that even when you get vaccinated, you don't go down to business as usual. So all these things will be challenging conversations we would have to have amongst ourselves, with government and the Ghana Health Service leading, moving forward to ensure that we behave properly. Unless until we get that behaviors right, we are not going anywhere any quickly, Samson. We'll be in this for quite some time.
Interesting. There's a question I asked Dr. Servakin, and I want you to also give us a brief about it, whether or not we are at a point where we should also begin to behave like others who are placing travel bans, reintroducing travel bans, particularly for countries like where you are?
Well, Samson, the points I made earlier about the fact that we don't even know if the variant is in our country is instructive. Because why has the European Union suddenly opened up? And the European Union has opened up to UK travel now based on the fact that, drivers who are crossing from the UK into mainland England and Europe through Dover and other things have to be tested for COVID before they exit. We already have a testing 72 hours and a testing at the port. I believe that suffices, especially when we don't know that the virus, particular variant, is already in our country. Because where are you going to start and where are you going to stop, Samson? It's already in South Africa. It's in Nigeria. Now Nigeria are going to open their, and these are different variants. You don't know if it's already in the United States. It's been reported that it's already in Denmark and Netherlands. So if we're going to do that, then we might end up shutting our border. And our economy relies on us being able to be open up. So it's a chicken and egg situation that you cannot just go blanket, let's ban everyone from the UK. What if the person takes KLM, for example, and goes to Amsterdam and travels into Ghana? There's so many things that go into locking down. And that's why I'd rather our testing is more robust rather than being draconian and say we're going for exclusion, because our economy is not built to withstand exclusion that much.
All right. In the UK and the US, they have discovered the virus has mutated. And these discoveries have happened because of because the scientists there are constantly sequencing, the genome. And like Dr. Servakin said, we need to do a lot, monitoring, evaluation, and so on. I don't know if that is almost like this. In Ghana, we heard that scientists sequenced the genome once. Have we kept, doing it to know if there have been mutations here? If not, then could it be that there is a new strain in Ghana that we don't know of? You say we should thank God that we don't know if anything is here already.
See, there's a lot to be thankful about when it comes to this virus in Africa. And reasons why we have to be thankful, we don't know still. A lot of the school of thought is around our lower median age, which means that we've got a much younger population. And if you look, the virus disproportionately kills people over the age of 60 years and people with comorbidities. I remember one of my friends, Dr. Yaobedi, always says that unfortunately in Ghana, the people that the virus has to kill are dead. So that gives us a bit of an advantage. The sequencing, I know that, yes, when they identified it, that in July, in September, they released another paper which talked about the prevalence rate in Accra being about 20%. And in that paper, they did allude to the fact that there had been some slight mutations, but nothing major. But like Dr. Sevekin said, I had said as far back as June that this virus is the most dyslexic virus I have seen in my life. And it doesn't make any apologies for its dyslexia. It doesn't care that it cannot read itself properly. In a human being, if our genes misread themselves, there'll be a shed load of cancers and all of other things that will kill us all off because we are not replicating properly and our cells will start growing irrationally and will die. But this virus enjoys doing that. So the thing that is actually detrimental to us is what makes the virus thrive and makes it even more dangerous to us. And Dr. Sevekin said, when the mutation is on the S protein, the spike protein, then you're dealing with another kettle of fish regarding this virus. So not knowing is not a good thing, because what if it turns around that we suddenly become a beehive of a lot of mutants that later on, when the world opens up and a lot of people have been vaccinated, would make it difficult for us to travel out. And that is why I agree with Dr. Sevekin. We need to invest in sequencing. We've got a scientist, we've got Noguchi, we've got KCCI, we've got the West Africa Center for Cell Biology into Infectious Pathogens. We've got all these things. Let's invest in them.
All right.
Because without that investment, they cannot sequence.
Okay. So let's have your final word also on this, and then we can get to our next issues. And I must also acknowledge that we have been joined by Peter McMenu, the 2020 campaign manager of the NPP. Thank you very much for making the time to join us, sir. Great. So yes, let's have your very final word, and maybe directly we're looking to leadership, but also to we the people and the prospects of going back to the classroom.
You see, that's the thing, Samson. I live in a country where my kids have been in school since September, albeit with considerable restrictions and changes in their behaviors. They've got to wear nose masks and other things. But when this variant came, I received immediate direction towards the end of last week saying that the children, my second son is going to write his GCSEs this coming year. So they have to come to school because they are going to be writing their exams. But for my last two, they are going to go back to school in a staggered manner. But the caveat there is that if you are a frontline worker or work with a health service or stuff like that, like I do, you're given the option if you want those children to come to school, if you don't have the ability to provide care for them or it's going to impact on your ability to deliver as a health professional. So all these things are in place, but the slant is that we cannot afford to keep our children out of school indefinitely. The psychological risk, the psychiatric risk, the risk to their education is far too high, especially when the virus doesn't kill them in a proportionate manner. Because if you look at 0 to 19 years globally, the mortality rate is less than 0.2%. So are you going to keep those children at home for that long? But these are the same people, especially between the 12 and 21-year group, who are transmitting the virus exponentially in the UK currently. That is where the heart of infections are. So to open up and let them go to school would be good, but we need to get them to have the right behaviors. Otherwise, they will become the new propellants of this virus in our population.
We have the benefit of having had, students return to school for a certain period to prepare for exams. So we have already experimented. So we are better if we want to introduce physical attendance to school, right?
I would say so, but the point is that at the time we did it, the concentration on the students' behavior, they are wearing a face mask, Veronica Bucket, if you remember the president's address and all that, was high.
Right.
The Ministry of Education was enforcing these things. These kids have now then come home and are seeing their parents, who have to be role models, not adhering to any of these things. What sort of behaviors are they going to take from home to school? And that is what is going to inform whether they are going to behave properly moving forward or not.
All right, Kwame, thank you so very much. And on behalf of the production team here, and you are not leaving us. We want to test your understanding of the politics. On behalf of the production team, I want to say special thank you to you, Dr. Silva King, Dr. Justice Yansing, Dr. Titus Bayu, Dr. Michael Owusu, Dr. John Amwesi, thank you so very much. Dr. Franklin Bequem, Dr. Nsia Sari, Dr. Patrick Abuaji, Dr. Patrick Kumar Abuaji at the forefront all the time, Dr. Ernest Kenu, Dr. Lauren Sofori Boedu, Dr. Ernest York, Professor Alfred Edwin Fifi Yelsin, Dr. Benedict Tego, Nana Kofi Kwachi, Professor Kwejo Koram, and Professor William Ampofo. All of you at the Noguchi and at the various centers where the testing has been going on, we want to say thank you all so very much for assisting the people through this medium, either through NewsFile or our various programming to educate the people. It has contributed significantly to, the providence that we have enjoyed here in the country over COVID. Without that, I doubt today we would have been talking about only 54,000 people who have had to suffer it. And I say only because in the scheme of things, that appears to be a small number. Unfortunately, 333 people died, and out of the 54,000, almost 53,000 have recovered. Thank you all so very much. Now, Rhoda, Professor Enin, I'm coming to you, but quickly, Dr. Abochi and Mr. McMenu, what's been your experience with COVID? What's been your response at home and at work? I have Veronica buckets, I have the sanitizer, and I also have alcohol spray. We go out, anything that is bought from outside and brought in, it must be sprayed. If it's food stuff, it must be dumped and washed. There's salt washing and everything. Anybody who comes in must follow the protocols. And even the kids are aware and they insist.
Well, perhaps Mr. McMahon is my senior in life, I'm sure. I would want to hear what he did first.
Let's hear from you.
You want to hear me first?
Yes.
But it's been a very eerie moment for all of us. In the beginning, I think we're all being very cautious. And then a point came where you ask yourself, how cautious can you be? You touch this and you have to sanitize. You want to take something from a bowl or whatever, something to put in your mouth, and you realize that a portion of your hand just touched a portion of the bowl which is probably not sanitized.
Yeah.
The question is, how clinical can you be? And so I think at the beginning I was trying as much as I could. But let's be honest, a point came where one just realized that one has to try and do so much without, frankly, appearing ridiculous.
Right.
And I have a 2-year-old, a nearly 2-year-old at home. Okay. And you can imagine, they have nothing to do with nothing. Mm-hmm. They'll roll on the floor, they'll do all kinds of things that you consider the most sad part for me especially was when you came back from work and you have a 2-year-old who wants to hug you and you can't.
Exactly.
And you can sometimes see him crying and they're trying to tear him off you because he's not supposed to hug. It's psychologically and sociologically depressing. And so I am thankful. I'm thankful that as a country we are where we are. I'm thankful for myself personally that I've been able to, well, so far, and I have to be honest, I haven't tested, so I don't even know whether I have gotten it and recovered. But whatever it is, I'm thankful that I have not suffered from it yet. So yes, that's my experience.
Right. You know some people who have suffered it, probably died. Yes. I know some people who have
exactly
gone through that.
I know a few people. I know 1 or 2 people who have died from it, and some people who have suffered and recovered.
Yeah. I know some families, and it was very devastating for them. Yes, Chairman.
Yes, sir. Thank you, and good morning.
Good morning.
I tested negative, and I was admitted to the ICU, intensive care unit in Kolebu. And I saw people dying right away in the ward. So I have gone through COVID-19, except I didn't get to the apex, if I may use that word, where you are put on ventilator. But I saw people on ventilator. I saw people on oxygen mask. And I had the smaller ones on my nose to be able to breathe effectively and being monitored, the oxygen level with various medical equipment monitoring. So it's not the best of disease at all, and you can't breathe properly.
Yeah.
And I would say a big thank you to the staff of the ICU, the nurses, the doctors, all the medical team, Kolebu, because they are doing a wonderful job there.
Right.
So
your encounter explains why almost everywhere I have seen you, I don't remember seeing you without a mask.
Oh, I'm always in a mask. I mean, there's no doubt about it.
Okay.
Sometimes my wife will ask me, but there's nobody here, why are you in a mask?
Yeah. Right.
So,
all right.
We have to prevent ourselves.
Thank you.
Because it's a deadly disease.
Right.
I think the biggest challenge for me, the biggest challenge now probably listening to what they're saying is how to deal with the issue of fatigue. The COVID fatigue, because also it's an invisible disease, unless you actually see someone suffering from that, there's a danger people become fatigued. And how to deal with that from the psychological standpoint, I'm sure, is the biggest challenge for leadership moving forward.
Right. But moving forward, as you have heard the experts say, we are not out of it yet. So let's all continue to practice the protocols. Let's continue with the protocols. Wash your hands with soap, running water, and sanitize as often as possible. And get your mask on. It's actually an offense not to wear your mask once you step out of your door. But it does appear too many of us are beginning to slack. We don't want to do that anymore. Even here, when we get into the studio these days, what we do is we say, okay, there are 2 people in the mask. The third person, maybe take your mask off and feel free to be able to communicate effectively. And we have been doing that for a while here. There are some people who say, no, we should continue religiously with the mask. We want to thank all the frontline workers, everybody from leadership, from the top, from the presidency, to the very last person who is cleaning the hospitals and doing all the work to ensure that we have managed it up to this point. Let's continue this way. far improved so that we will be alive. All right, now let's begin. Yes, we take a quick break, and when we return, we get to the politics of the elections. We'll be right back.